My name is Anthea Towers, and I head up the Health and Wellness team at Tennant Life Benefits. We are the brokers to your medical aid. Before I hand over to Zanele Buthelezi, who's with us on this call, to take you through the product details, I'd just like to introduce you to my team, because together we are here to assist you and to support you during the course of the year. So over to you, Jaco.
Hi everyone, I'm Jaco van Staden. I'm the healthcare administrator and broker under supervision for the health and wellness benefits team, which works with Anthea.
And I'm Jessica Frew. I'm also broker under supervision, and I assist with member queries and general medical aid inquiries.
Thanks, guys. Okay, before we start with the details, let us just discuss a couple of housekeeping issues related to this year-end process. In the next week or so, which is early November, you will be receiving as members an email from the Tennant team. It will be sent to your address that you've got registered with Discovery Health, whatever that active email address is. In that emailer will be a link that will take you to the Tennant website, where you'll be able to download various pieces of information that explain the product in more detail. There's a product summary that we've put together as Tennant. There are also a couple of videos and doodles that you can watch that will tell you more about the product, and will also tell you a little bit about gap cover and why it's an important benefit to consider as a supplement to your medical aid. And in addition to that, what I wanted to share with you is that we have the Tennant app. This is an app that you can download from the Play Store or the iStore. And once you've registered on the app, you'll be able to view your plan details. You can also submit an option change to us using the app, and send us a query and sign up for gap cover. So there's a lot of functionality there, and we do encourage you to start using the app and to engage with us on that basis. For those of you who are looking to make a plan change for January of next year, please be aware that the deadline for option changes is the 30th of November 2021. So we do need to receive your option change request by that deadline. If you do not submit an option form, it means you're happy to remain on the plan that you're on, and you will just continue on that plan in January at the start of the new benefit year. One other piece of information I'd like to share with you on the next slide is relating to who to speak to if you have any queries or any concerns. So Zanele, if you wouldn't mind, thank you. When it comes to advice and benefit information, Jaco and Jessica are here to assist you. They will answer any questions you've got and assist you with information regarding option changes. When it comes to escalated queries, that's where we also get involved as Tennant. So generally, you would first contact your medical scheme to try and resolve a benefit or a claims query. If you encounter difficulties and you need to escalate that, we are your escalation channel. And we're also here to help you with any new member application forms, or whether you're wanting to add a dependent like a child or a spouse. So with that, I think we will hand over to Zanele, and she can take us through the product highlights. Thanks, Zanele.
Thank you, Anthea. Thank you so much. I am delighted to be here to present to you the product updates for 2022. And towards the end of the presentation, I will also be sharing the vitality updates as well. Our core purpose at Discovery is to make people healthier and enhance and protect their lives. And this core purpose has never been so relevant in the past 2 years. You will agree, as we are busy fielding COVID-19 as a scheme, we are making sure that we are enhancing and protecting your lives. On our sustained performance as Discovery Health Medical Scheme, we are happy to announce that there is sustainable growth despite the challenging environment, whereby we are having over 2 million beneficiaries on our plans. We also having strong operating results with positive 7.4 billion in our reserve. And what this means is that it's increasing our solvency levels, in that the legislation says that for a scheme to sustain long term, we need at least 25% in reserves, and we are sitting comfortably at 36.9%. So for us, this speaks to the schemes being able to fund for future claims and being sustainable in the long term. So let us start with the discussion around the contributions. And you will agree that this is an interesting discussion, because we are really in a bit of tug of war around these opposing forces. At one point, we have to look at the long-term sustainability of the scheme, but we also have to make sure that in the short term, you as our members can be able to afford their premiums. So on the one hand, we are seeing that the economy is gradually recovering, and we are seeing how the COVID-19 economic effects have had an impact on affordability for you or as our members. And on the other hand, affordability also for you as our members is critical. And at the forefront of this debate, we recognize that we still have drivers of medical inflation that are impacting our long-term sustainability. And over here, for example, we're looking at tariffs, which are the increases that we have to give our providers, doctors, and hospitals. We still have to look at the demographic risk, which speaks to the age of our members as well as chronic prevalence. And at the same time, healthcare utilization is one of those that we also have to consider as a scheme. So we have to make sure that we balance these two so that there's no future price increase shocks in the future, but making sure that, of course, in the long term and short term, you as our members can be able to afford these premium increases. So with that being said, we're seeing that the medical inflation for 2022 is expected to be at 7.9%. And informing this required contribution for 2022 is our ability as a scheme to ensure that the contributions are kept in pace with the expected healthcare claims as a result of the healthcare utilization. So we are seeing an expected medical inflation in 2022 at 7.9%. And the builders of this is that those tariffs that I've spoken about at 4.4%, 3% for our demographic risk, which is like the demand and the supply for the scheme. Also, utilization, we are looking how the future projections are around healthcare, more so with COVID-19 being around, and that is at 1.5%. And we're happy that our risk management tools, whereby we're seeing how healthy lives that are joining the scheme on the vitality side as well, are reducing this expected medical inflation to keep it at 7.9% for 2022. So the reduction in the healthcare claims as a result of COVID-19 utilization discontinuity has strengthened the reserves position for you as our members of the Discovery Health Medical Scheme. So these strong reserve positions are relative to the regulated solvency requirements that I've spoken about, and this has allowed the scheme to defer the required contribution increase for 2021. Remember, we only increased the contributions this year from July. So this was to ensure that we provide financial relief to you as our members without compromising the long-term sustainability of the scheme. So the COVID-19 discontinuity in 2020 did strengthen the position for Discovery Health Medical Scheme, and Discovery Health Medical Scheme was the first and only open medical scheme to freeze contribution increases, and that has seen us being able to leverage 2.2 billion of the improved reserve portion, meaning that we were able to defer back into your pockets savings of up to 2.2 billion in terms of contribution. So with that being said, we are happy that as a scheme, we were recognized by the Council of Medical Scheme, and the council did mention this strategy that we took, and that was mentioned in that Circular 42 of 2021. So in line with that, we are then coming up with the contribution increase for 2022 to be at 7.9%. And this contribution will only be effective from the 1st of May 2022. So meaning for the first 4 months of the year of 2022, you will only be paying the 2021 rates. And from the 1st of May, it will be 7.9. And when we average it out over a 12-month period, this will come to an effective increase of 5.3% for 2022. This is in line, of course, of us maintaining that long-term sustainability and short-term affordability for you as our members. Over here, we want to show you the extensive range of plans that we offer and the choice in terms of affordability for you as our members. We have 23 plans at Discovery Health, and we want to make sure then that as our members, you can be able to afford these plans, and that can speak to your pocket and the needs that you have from the scheme. So reminding you here also that we are only going with our increase from the 1st of May in 2022. So here we are also showing you the 23 rich plans or suite of plans that we are having as a scheme. And we've got then these 23 plans divided into what we call 7 series. So we've got the KeyCare Plus, KeyCare range, which comprises of KeyCare Plus, KeyCare Core, KeyCare Start. We've got the Classic Core, which has got 5 of these plans. We've got the Smart range, which has got 2 Smart plans. We've got the Saver plans, there's 5 Saver plans. We've got also the priority plans, there's 2 of them. On the comprehensive side, there's 5 comprehensive plans, and there's only 1 executive plan. Why we're showing you this is that as a scheme, we always want to remind you of the plan range that we've got, and it is key for you as our members to always know what plan you're on, because then that speaks to the benefits that you are getting from the scheme. I also want to take some time to remind you of how these plans work. We have what we call a product platform. So all these 23 plans work on this similar platform. And as we go along, you will get to hear the differences that I'll mention in terms of these plans. On the left-hand side is normally what you pay to the scheme, what we call the peace of mind should anything happen. You want to be covered for you and your loved ones. So all of our plans have got what we call a hospital benefit. There is no overall limit to the cover that you get. The only thing that we need for you to do is to authorize your admission, especially if it's a planned procedure. If it's an emergency, the hospital will do that on your behalf. Please do not worry about that. There are plans that when you are on them, you need to go to those selected hospitals. We call them networks. Those are plans like the KeyCare plan, the Smart plans, for example, the Delta plans as well. So key for you on a planned admission to please use those hospitals. And in a case of an emergency, you can be taken to any hospital. Once stabilized, we will move you then to one of those hospitals. So this range is offering that unlimited cover, as I said, and anywhere where your plan starts with a weight classic, it means in hospital you covered 200% of the Discovery Health rate. And if the name starts with essential, then you are covered 100% of the Discovery Health rate. Then we've got the chronic illness benefit. And what chronic means to us is that is medication that you are taking for 6 months and longer. Every day there is a pill that you are popping that is chronic to us. So as a scheme, you are covered that for this is also referred to as a prescribed minimum benefit. And on our executive and comprehensive plan, you've got access to 61 chronic conditions. And on the other plans, then you've got access to 27 chronic conditions. We also give you cover for screening and prevention benefits. Over here, we believe as a scheme that prevention is better than cure. So there are certain tests that when you go and do them, like the mammograms, pap smears, prostate screening, for example, for the kids, for the dental and eye checkups. So those are covered from the screening and prevention benefits. Then on the right-hand side, that's when our plans start to differ. There are plans that have got what we call a medical savings account component. This is mentioning like your executive plan, comprehensive series, the priority series, as well as our saver series, for example, with the exclusion of our key care plans, the core plans, as well as the smart plans, because these ones don't have that medical savings account component. And how it works then is that we allocate 25% for plans that are like the executive comprehensive priority plans. In terms of your overall total contributions, that's what we allocate towards your medical savings account. And where there's a weight classic, you get up to 25%. And on the weight essential, you get then 15%. And this medical savings account is allocated on the 31st of December every year, midnight. And the funds are available from the 1st of January. As to how you use these funds is up to you as our members. It's for all consultations that you do out of hospital, be it GP consultations, x-rays, blood tests, you name it, anything out of hospital or called day-to-day consultation. Then if there's any funds that were not used in that specific year, we then as a scheme allocate them to the following year for you, so you don't get to lose those funds. We also have what we call a day-to-day extender benefit. We've had your outcry. When we do this session, your feedback is key. There has been instances when you say that, you know what, the savings does run out and then I'm gonna have to wait for the following year for it to be replenished. We're saying all is not lost. When you are on those plans that have got a medical savings account component that I've mentioned, you do have access then to this day-to-day extender benefit. And what this means is that you can go to doctors on our networks, and when they come out, or you can search for them on our website, www.discovery.co.za, or on our Discovery app. When the doctor comes up with this logo of Discovery, it shows that the doctor has got full cover choice with us, or they are on our network, and you will then be able to consult with these doctors, even if you don't have the medical savings account. When you are on the executive, comprehensive, or priority plans, you get unlimited consultations with these doctors. And when you are on the plans that have got classic, the word classic or essential, you get up to capped visits. For example, if it's a classic saver, you will get up to 6 visits for a family. And if it's an essential saver, for example, you'll get up to 4 visits for the family. So what this means then is that you can go consulting with these doctors while you are in your medical savings account has run out. And for those plans like the executive, comprehensive, and priority, is when members are normally in their self-payment gap as well. So we want to make sure that while the members are in their gaps, they can be able to consult. We also have the above threshold benefit. This is applicable to the executive, comprehensive, and priority plans. Medical savings account gets allocated. It runs out, members go into a self-payment gap, but still have access to the day-to-day extender benefit. And once the gap is closed, then the members go into the above threshold benefit. And we also have the maternity benefit, which offers the extensive range of cover. While the mom is pregnant, there is cover, to the antenatal classes and consultations, certain blood tests that are relevant to the pregnancy that can be covered from the maternity basket. And once the baby is born, for the first 2 years of the baby's birth, we also support the mom and the child with the pediatric consultations, lactation courses, mental consultation if a woman is going through postnatal depression, for example. So that is the rich range of benefits that we've got. And on this maternity benefit, we ask that you please, as a lady, activate this benefit when you find out that you're having this good news. It can be done on the website or on the app as well. And all of this extensive product platform is supported by our Vitality program, which I will discuss with you later on in the presentation. We're also having exciting updates for 2022. We have targeted benefit enhancements. I'll start with the enhancement on the assisted reproductive therapy benefit. So what we did as a scheme in 2021, we introduced this benefit, also taking from your feedback, and we are helping families that young families that wants to start their families. And here we are saying that this is extended to the executive and the comprehensive plans at the moment, and we are enhancing it with cover for seropreservation, embryo freezing, and egg donation cycles. We also having updates on the allied therapeutic psychology extender benefit, where the cover is extended to include moderate to severe strokes and head injuries. So we taking away the 2-year cover limit that we used to have on the following conditions, which is the hemiplegia, the paraplegia, the speech and swallowing disorders, strokes, and head injuries. We also have enhancements on the palliative care offering. Over here, we're having the advanced illness benefit that will be enhanced to provide unlimited cover for palliative and end-of-life care for both our oncology and non-oncology patients with advanced illnesses. We're also having enhancements on our trauma benefit. So we have a benefit called Trauma Recovery Extender Benefit, or referred to as TREP. And this benefit is applicable to all our Discovery Health Plan members. And the benefit entry criteria has been amended to make sure that we include high frequency admission in high care or any number of days in ICU for a defined trauma event. And families that are also having their loved one going through this trauma will also have cover for up to 6 counseling sessions. We're also introducing a basic dental trauma benefit. The outcry also from you as our members has made us to go back to the drawing board, and we are happy to introduce this basic dental trauma benefit. It is applicable to all plans except for the Essential Smart and KeyCare plans. So here we will cover for partial or complete loss of one or more teeth as a result of an accident or an injury. On the other technical updates, we are also having the GP allocation for management of all of our chronic disease list conditions, or those prescribed minimum conditions, benefit conditions that I've spoken about. So from January 1st of 2022, members can now nominate a primary GP that can manage all their prescribed minimum benefit chronic conditions. We also, on the chronic illness benefit, having an update whereby from the 1st of January 2022, we're having changes to the formulary and the chronic drug amounts, and all those members that are affected, communications are busy or starting to go out to them to communicate these changes. We're also having the updates on the benefit limits, co-payments, and deductible increases for 2022, whereby we're gonna have co-payments and deductibles increasing by 4.5% from the 1st of January. We're gonna have the medical savings account replenished on the 1st of May when we do our premium increase, that 7.9% increase that I've spoken about. So in line with the medical savings account, with the premium increase, we also need to increase our medical savings account. There are benefits that will remain unchanged. For example, our oncology thresholds, our international travel benefits, those will remain unchanged for 2022. As a scheme, we are recognizing that there is global expansion for hospital to be taken to home. And what we're seeing is that there is the need to ease the burden of increasingly overwhelmed healthcare systems. And this has highlighted the patient's home as an important and relevant setting for delivering healthcare. You will see, of course, here with the stats that we are showing overseas that this is now key, and globally, this is the trend that is there. And as a scheme, we're saying that there has been a need for a hospital at home program with increasing evidence to support the treatment of medically appropriate condition in a patient's home. And with that being said, I am delighted to introduce to you Discovery's largest private hospital, which will see 750 virtual beds that the members will have access to and having to receive care in the comfort of their beds and space. And this will be supported by a 3-pillar of clinically oversight staff, be it our doctors and allied workers, to make sure that our members are monitored. There will also be remote monitoring that we will offer to our members to make sure that we keep up to track as to what is happening. And there will be also that hospital care program and diagnosis whereby we will be able to identify members that qualify for this. You will recall that we did introduce connected care at home for acute cases in 2021, and we are taking learnings from this, and we are happy to launch Discovery Hospital at Home. So with this benefit, it will be available to all 18-year-olds admitted with 18 and above, admitted with or requiring admission for a primary diagnosis for any low frequency medical conditions, or admitted with post-op selected surgery conditions. So we will make sure that we roll out this program and support our members as they are in the comfort of their home. And in 2020, we did launch the connected care that I've mentioned, and we rolled it out in 2021 for acute care at home. And this was providing quality and qualifying members with quality and appropriate clinical treatment. And for us, the patient-centric outcomes were key. And we've taken learnings from this, and we have seen how there were over 100 admissions that we did at home, with over a cumulative days of treatment of over 425. This was supported by the 24/7 remote monitoring at home through a device called BioBeat. And BioBeat is able to send up to 15 readings to our dashboards, where there are case managers that are watching these, and there's live readings that are happening, and our care team also on board with this, so that if there's anything out of range, the members can be supported. So with these learnings, we are happy that this hospital care at home will be able to support our members in need and in support of this hospital care. With these learnings that we've taken also from the introduction of connected care and how we are launching the hospital at home as well, we are pleased as a scheme to introduce also the Discovery Patients communities. These will be powered by my health team. So we will initially roll out my diabetic team, my heart or cardiac disease team, as well as my COVID team. And the reason for this is that we've seen how, as members are fielding COVID-19, as well as if they've got any chronic condition, that they rely on sources of information, to read about their chronic diagnosis. And the doctor becomes, the top in the list. And then there's online searches that members do. There's medical websites that, people do researches on, also relying on friends and family for information, as well as social media. But we've seen how this is creating conflicting clinical guidance for our members. And as a scheme, we've seen the need to make sure then that we roll out a platform for our members where they can have social support, connecting with patients with the same chronic condition, be able to get accurate clinical information about their condition, engaging with medical experts to be able to get clinically moderated information, also personalized personalized content where people can read about their condition, specific curated content, and also making sure that there's better health outcomes, because remember that core purpose of protecting and enhancing your life as our members. So we want to make sure that our members are protected and getting real-time information. And you may ask to say, why only these my team's conditions? There's a whole lot of them, but as a scheme, we've seen how my long COVID is taking prevalence, whereby there's evidence now of long COVID emerging in healthcare claims. So as we're seeing claims and receiving claims, we're seeing how people that were infected with COVID, long term now, they needing a lot of support, be it on the oxygen side, being it on also on the follow-up treatment that they have to get with the doctors. And we've also identified that on the diabetic as well as on the cardiac side, when people have had exposure to COVID, for example, then there is an onset of diabetic, there's an onset of also cardiac conditions as well. And this poses a risk because members then get to find themselves admitted longer and higher, periods and frequencies in hospital. So we've identified that, long COVID is now one of those long-term that we're looking at, but with those conditions creeping up in conjunction with those long COVID conditions, being it the diabetic and the heart disease. So with those learnings, we are hoping that as a scheme, you as our members can interact on these platforms, and there are clinical entry criteria, and you can always register on these platforms. Now I'll take you to the enhancements of the Discovery Pay. And over here as a scheme, we are coming up with a sophisticated, seamless process of how you as a member, as our members, you can be able to go paying for your claims and medical consultations. So we want to make sure that, there's 3 pillars that can support you on this one. You can be able to pay your contacts within the Discovery Bank. You can be able to pay for your health, and this will be accepted at pharmacies, at hospitals, at labs as well, with over 6,400 GPs that we are busy linking and contracting to be able to take Discovery Pay. And also on the Pay as you gym, you will be able to also pay for your gym at one of our partners, be it Virgin Active or Planet Fitness, for example. So we want to make sure that this can be activated in the Discovery Bank, and you can enjoy all the features at no additional monthly costs to you as our members. And how this is going to happen, you will agree that, the last thing that you need as a member is to be worried about follow-up bills and claims that you are getting after the fact that you have consulted with the doctor or you've been at the pharmacy, for example. So we want to make sure that paying for your healthcare is easier. We've got contracted pharmacies, we've got hospitals and labs and those GPs that I've mentioned. And this benefit will be available from January 2022 with those GPs that have got a direct contract or billing system with us, and quarter 2022 also for other participating GPs. We will roll this out too, and it's only applicable for members of the Discovery Health Medical Scheme. And first individuals to activate the Discovery Pay will be the nominated account holder for all Discovery Health payments of the Discovery Health Medical Scheme policy. And this will be easily kept track by your healthcare spend. There will be interactive dashboards in the Discovery app, whereby as a member, you will have the ability to group your healthcare spends by the healthcare categories or professionals and source of funding. So as a scheme, we are very excited to roll this out, and we want to make sure that it's a seamless integration that will enable seamless and easy process. And on the doctor's side, they will be able to submit the claim and check for benefits from the scheme and be able to pay for any shortfalls or outstanding bills. And as a member, you will also be able to receive confirmation of this full settlement from your Discovery Health Medical Scheme platforms and the nominated pay account to say, where did this payment come from? So there will be a QR code that you can be able to scan as a member. You can can capture your claim details, you can submit the claim, you can receive proof of payment, as well as be able to get confirmation of the balances thereafter, after these transactions have taken place. We also excited as a scheme to introduce to you Pay As You Gym. And earlier on, I did introduce it on this Pay As You Go. So we're having over 150 facilities nationwide, where as a member of the scheme, you can be able to use the gyms and pay as you go. So for members that are not having a contract, for example, at Virgin Active or Planet Fitness, we're saying then at 75 Rand per visit, you can be able to have access to these gyms. And there's also those flagship gyms whereby then the fee will be 100 Rand per visit. So members, you will also have access to 3 visits per partner included upon activation on this benefit. So we are excited about this process as well. And we want to make sure that it's a seamless process for you to pay as you gym. You will also choose a preferred gym and scan your QR code. Also, you can remember, you can choose from over 150 gyms nationwide, and you can filter on any gym activities and any amenities and any distance that is there from you to that gym. You can be able to confirm the payment. You can choose to pay from the Discovery Pay account, or you can use your miles, and you will then receive your proof of payment, and this will show the payment at the gym reception, where you can show it to gain access for that visit that you have already paid for. So these enhancements, we believe, are gonna be exciting for 2022. And I'm now gonna take you then on the Vitality side, the enhancements on Vitality. So Vitality is our worldwide renowned wellness program that rewards and incentivizes our members for participating in healthy behaviors like living well, driving well, as well as spending responsibly. So with the Vitality program, we've got 3 Vitalities, Vitality Active, we've got the Vitality Premium, as well as Vitality Purple. And Vitality Premium then is one where you will also get, the premium health, lifestyle, and leisure benefits, the one that will give you access to improved benefits that I'm gonna be sharing with you as well. We are seeing also how there is a link between healthcare outcomes as well as vitality engagements. We're seeing how COVID-19 infections are still there, and we're seeing how there's an increase in death risk here in South Africa. This has been around 2020. We're still seeing this in 2021. We're seeing how almost 2 to 10 people, are elevated with death risk because of the COVID infection. So as a scheme, we are excited to say that we are offering Vitality points for our members that are vaccinated. So what this means is that we want to make sure that the vaccinations, are speaking directly to the COVID-19 mortality deaths, reducing that. We're seeing how people, when they are vaccinated, their risk of contracting COVID-19 is minimized. And even if they are to contract it, their survival rate is more as opposed to non-engaged Vitality members. So with this being said, our vaccinated members will get up to 2,500 points in 2021. Remember, there's 2 kinds of vaccines. There's the Pfizer as well as the Johnson & Johnson. Pfizer, there's 2 jabs or vaccines that one has taken, and Johnson & Johnson, there's only 1. So we will make sure that the vaccination points will be awarded as a once-off for members that are fully vaccinated with Pfizer, meaning 2 jabs have been received, or the Johnson & Johnson 1, and we will allocate those points. And points will also automatically be allocated for members that have registered on the electronic data system, the EVDS, or on our Discovery Connected Care platform, or members can call our Discovery Vitality call center to get their points. And we will also make sure that the points are awarded retrospectively in 2021 for members that are fully vaccinated. And members can only earn points if they take the COVID-19 vaccine in South Africa. And over here, you will then see the updates that we are having in terms of the Vitality Travel. We want to make sure that as our members, you can go everywhere with Vitality Travel, where you can enjoy up to 75% off travel with our new airline partners like Airlink, SA SafeFly, and LifeFit in 2022. Plus, you can book your entire holiday experience from flights to car hire and accommodation, and all this is through our Vitality Travel. You will also notice that then we've got local flights of up to 6 flights per annum, and these are one way. And on the international flights, you've got up to 2 bookings per annum that you can get, and this may include multiple flight legs. There's accommodation that I've spoken about, and our partners are Proti Hotels and Yotsogo Sans, and we've got the travel packages. We've got new partners that are joining us, being it the Beachcombers as well as the World Leisure coming on board. And of course, we still have on the car hire side our Europa car as well as Tempest car hire. So this Vitality Travel benefit is available to all Vitality members through the Discovery Pay account as well from the 1st of January 2022. And as members, you can use either the Vitality Travel or kulula.com to make your travel bookings. And we will also want to make sure that this travel platform is seamless, where you can be able to view and book all your flights and accommodations and car hire on a single platform. And we will make sure that you can understand and manage your travel rewards also within that integrated Vitality discounts and savings that we will show you on all the bookings. We will make sure that integrated trip management is there, where there can easily be a view of where you are going, and you can change your travel bookings as well. Have access to a digital vault to store also your passports, your visas and important documents, and also any access to travel ancillaries like the travel insurance when booking international flights within the Discovery Bank credit card. There's also purchase of additional top-up travel cover on the platform, also that baggage and valuable insurance that you can take as our members. So this is available from January 2022 on the Discovery Bank app or website, and is available to Vitality members. All Vitality members will get access to the Discovery Pay functionality, including the Vitality Travel platform, and we will make sure that then you can activate the Discovery Pay on the Discovery Bank app at no additional cost to have access to this. We also wanting to make sure that we are about to shake up your summer. You'll soon be able to share your Vitality Active Reward achievements on social media, right from the Discovery app, and you can get also new summer gear from Sportsman's Warehouse or Total Sport for the value of a coffee. So we're seeing how these platforms will work from the 1st of November 2021, where you can share your progress and achievement on social media. We want to make sure that you can be able to create a Vitality Active Rewards team to be able to earn bonus play and win prizes, and this will be available from January to February 2022. As a scheme, we also wanting to make sure that on the Discovery Baby, on the Vitality enhancements, there's a Vitality Health Baby that takes rewards for parents to a new level. Vitality members can get up to 50% back on thousands of healthy baby items at Baby City, Baby R Us, and Toys R Us stores. And members can also continue to enjoy rewards through the healthcare benefits at Clicks or Discam. So this is seeing our members having access to the day-to-day essential premium essentials that they need for their little ones. And we're also having an update on the tobacco cessation, which is a Quit Genius. Members can get up to 80% off of this Quit Genius with 12 months fully funded digital smoking cessation program valued at 3,750 rand. So as our members, you will get then access to this benefit. And what this benefit offers will be that cognitive behavioral therapy through engaged mobile content. There's qualified quit coaches to offer personalized guidance. There are also going to be tracking tools to monitor triggers or cigarette smokes or money saved and health program, and also that nicotine replacement therapy through gums and patches to assist with ongoing cravings. So we've seen how there's almost 52% validated tobacco quit ratio through this tobacco cessation program, and we are pleased to be able to roll this to you as our Vitality members. So in summary of Vitality, we're seeing our rates in 2022. For a single member is 305 rand, for a member plus one dependent 370, as well as member plus two is 430 rand. Remember, I did mention that on Vitality, you get healthy and you get rewarded. So there's different ways you can get healthy, you can get active, you can eat well, you can take care of yourself, and you can be rewarded in terms of miles that you can spend on our Vitality Mall partner and partner networks that we've got. Also on the active rewards, there's also, travel like you've seen through Kulula and the international travel through the Vitality Travel benefit. And when our members are exercising and driving well as well, or on the Insure side, you get to be rewarded. So this is the rich enhancements and benefits that we've got for you on Vitality in 2021. And this then brings me to the end of our presentation. I would like to thank you so much for your time, and we'll stop here for any questions that you might have. Thank you so much.